I'm Calliope, and I am the otolaryngologist in this office. How you doing today? I see. Well, I hope by the time you leave my office, you feel even just the littlest bit better. Now, otolaryngologist is a bit of a long name. It actually is a little longer, but you may more commonly know it as an ENT or an ear, nose, and throat doctor. But I actually do a lot more than that. So we are going to be looking at your skin. For example, we're looking for lesions, signs of skin cancer. We look at the neck as well, but I will be primarily focusing on the ears, nose, and throat area. Was there any particular reason why you wanted to get checked out? Okay, sounds good. So if I could just have you confirm your name and date of birth. And is that your preferred name? How do you like to be addressed? Very good. So we're going to start with the face and a couple of cranial nerves as well. So I just want to look at the face. We're looking for any palsy, for example, any paralysis, any abnormal skin spots, colors, textures, things like that. Do you mind if I get closer so I can look at your face? Okay, thank you. We're also going to be going behind the ear here. This area, we have the bony ridge. That's called the mastoid process. So I'll be taking a look at that as well. Behind the ears, we'll look at the neck. There's a lot we can do here. So I'm just going to take a peek at you. Are there any areas of your skin that have changed that you're not sure about? Any new spots or any changes in the skin? Okay, good to know. So I'm just going to look right in the hairline here, because this is an area we don't usually catch things very easily, because many people have hair there. Just going to take a peek right there. Look through this area. Right. And then I'm just going to come back behind here. We're going to look back behind the ear. Okay. We're just going to take a little look in here. Good. Okay, the other side. Good. Okay, so skin-wise, there's nothing out of the ordinary back here. Take a look at the jaw. So we'll look at issues with the facial nerve as well, cranial nerve number 7. And that one, a big part of it is being able to move your muscles of expression. So we'll do a little bit of testing with that. I just want to get a little peek right here. Look at the trachea is going to be our big one. So we want to make sure this is midline. And I'm going to very gently palpate around it, but it can be uncomfortable. This isn't something we should be pressing too hard on, so just let me know if you need a second. But I want to make sure it is. Okay. Good. Now something else we want to look at is the thyroid. So what I'm going to have you do, I'm going to put my fingers right here, and I'm just going to have you take a dry swallow. Might be able to feel it, maybe not. If I could just have you swallow here. Just like that. Okay. Alright, good. Yeah, if I really felt it, for example, on one side, not the other, or if it was just very pronounced, don't really want to see that. Sometimes it's just barely palpable. Oh, and then while we're here, let's go ahead and hit some lymph nodes. So go ahead and come right back behind the ears here. Also going to get into the mastoid process a bit. Is this painful or tender at all as I just press along the bone? Okay, good. Now just feel for the post-auricular nodes, the pre-auricular nodes. Good. Okay, and then underneath the jaw, we have submental and submandibular. Okay. And in the neck, we have the superficial cervical, deep cervical chain, posterior cervical. A few different areas we can hit. Okay, good. So I am going to have you follow a few instructions that might seem a little bit silly, but we are testing your muscles of expression. So we need to make sure that the cranial nerve is functioning correctly. Otherwise, if it's not, then you're not going to be able to move your face correctly. So if I can have you close your eyes real tight. Close your eyes real tight. I'm going to try to open them. I'd like you to just resist me. So hold against me here. Okay, good strength there. Can you raise your eyebrows? You can open your eyes. Can you raise your eyebrows? Good, okay. And can you puff out your cheeks? I'm going to try to push them in like that. I want you to just hold against me. Just hold. Good. And then if I could have you smile real big. Okay, yep. Smile as big as you can without showing your teeth. And then if you could grin, so that would be with the teeth. There you go. Okay. And now if you could do sort of a frown or a scowl, something you're going to feel. So there's this big sheet muscle right here called the platysma, and that is what allows you to do that. So you might do that kind of thing. And you might feel it right in here. You can get the other facial muscles involved if that helps. There you go. Much better than I can. Much better. Now, if you'll just give me a moment. Let me grab a couple of rather rudimentary tools here, but effective nonetheless. So another one of your cranial nerves that I'm concerned with, in general the otolaryngologist is concerned with, is the trigeminal nerve. And this has motor functions, so it allows you to chew, for example. But we're going to test sensation, which it governs the ophthalmic, the maxillary, and mandibular branch. This allows you to feel pressure, soft and sharp sensations, cold, heat, vibration, for example. So I'm going to take a cotton bud, and I'm just going to run this in these areas. See if you can feel it, as well as this toothpick here. So this is just a pointed tip of contact. As you can see, it's not actually painful, but it's just sharp enough that your body registers the sensation. So we can do something like this, right? So I'll flip these to the other side, not the side that touched me, and I'm going to test this on the jaw here. This is what the soft should feel like. Right. This is what our sharp will feel like. Just like that. Alright? Okay. So I'm going to have you close your eyes. You could just close your eyes. And then we can test the sensation. So just tell me soft or sharp, whichever you feel. Alright? Okay. Soft. 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 Sharp. 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 Good. Soft. Sharp. Sharp. Soft. Sharp. Soft. Good. Sharp. 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 and soft. Very good. So, did that feel even on both sides? Did the soft and the sharp feel the same? Okay, let me clarify. Did the soft feel the same on this side as it did on this side, and vice versa with the sharp? Okay. Were there any areas where it felt less sensitive or more sensitive? Okay, very good. So we are going to move on to the ears, and I'd like to look at the outer ear to start. So here, this little cartilaginous and fleshy protuberance, this is called the auricle or the pinna. We have the lobe right here where I have the earrings. We have the helix where I have the single right here. We have the tragus right here, which helps to funnel sound into the concha, which is also called the bowl of the ear. And the folds of the ear are also tasked with funneling noise into the ear. So we have some different folds. We have the antihelix, which is on the opposite side of the helix. We have the antitragus on the opposite side of the tragus. We have the triangular fossa, which if you put your finger right here, you'll feel a divot or a depression right before this fold right here in the helix. This is called the triangular fossa. So, concha, antihelix, helix, lobe, antitragus, tragus, back to the concha. That's what I'm going to look at. And we'll look a little more at the mastoid process while we're there. So, let's see. Let me get a new cotton bud here. And it can be a little difficult to see in some of the folds here. So instead of using my fingers, I'll just use this to gently kind of pry that apart a bit if need be. So let's start right here. Now we'll take a look at the outer ear. So what I mean is I might just press this cotton bud around here so that I can get a better look in these little folds. So, is this uncomfortable at all? Okay, do let me know if it is. I'll take a look. Your helix. Good. Lobe. Folds here. Triangular fossa right in here. Concha, antitragus, tragus, and helix. Okay, let's look on the back here. So we looked at the skin. So just taking another little peek around here. And any tenderness while I'm doing this. Just palpating. No. Okay. Let's look at the other side. Just take cotton bud and just gently look at the inner folds here. Good. Just giving me some space. Take a good look. Give me some space. Have a good look. Helix, anti-helix, try and get the fossa right in here. The lobe, conch, pieces looking good, and then just taking a look behind here. I'm going to hold your ear and palpate right here. And that feels all right as well. Okay, very good. Let's see, I'm going to do just a little bit of palpation here. Let me know if any of this is painful at all. Just going to do a little bit of stretching. How does that feel? Okay, so if I pull up here, that feels okay. And what about the side? What about the lobe down here? Okay. And then if I just gently pinch around here, how does that feel? Okay. And I'm just going to very gently press around the tragus and the preauricular area. Good. Okay. And that all feels okay. Alright, excellent. So I'm going to take a peek inside the ear now. So I am going to be using my otoscope here. I'm going to attach a speculum, flip on the light, and then we're going to look in the ear canal. So I have a small selection that I can work with. There are some different sizes here. For example, this one is quite short with a medium opening. This one is rather long with a small opening. And I have two that are similar sizes with similar openings here. Now, when we use the otoscope, we actually want to use the one with the widest possible opening that is still comfortable, so that we can see as clear as possible. That is quite short with a wide opening, and we'll just click that into place. There, we've got a good wide amount of light there. So what I am going to be doing here is I will just place the otoscope in the ear, and we'll take a little look at the ear canal. If I could just have you stay as still as possible. I'm just going to put the ear back, and then we'll straighten out the canal. And back. There we go. I'm going to reposition now that the otoscope is in place. There we go. Okay, so it looks like the tympanic membrane is the correct color. It is intact with no perforation. The ear canal is clear. Everything looks good on this side. So now we're going to take a little peek. And this side, pulling up and back here, and then it's going to be bringing in here. There we go. We'll hear the honks of the geese. Lots of geese this time of year. And we'll just take a peek in our ear. Let's see. I'm just going to reposition a little bit. Make sure your canal's clean. Yeah, little hairs look good. Skin looks good. Tympanic membrane is pretty gray. Membrane is intact. Comfortable like this. Okay. Just making sure. Letting the geese pass by. Pull that out. The other ear looks very good as well, and you can hear at least somewhat well if you were able to hear those geese. But we're going to take it a step further. We are going to test different frequencies of hearing. Some people can hear everything but the lowest tones. Some people can hear everything but the highest tones. And some people might not be able to hear really any of those. So we're going to start with a really low tone frequency. This is 128 hertz. You might not be able to hear this one actually, so don't feel bad if you don't. It is quite low. Let's just test this. It's hard to hear it from a distance, but up close it's a little easier. So I am just going to strike the fork and you just tell me what ear you hear it in, alright? Good. Good. Now, our next one, a lot easier to hear for most people. This is 256 hertz, so let's listen to that one. Much easier. More of a mid-tone. Alright, so let's test this one. Left rather. That one's right. Very good. Now this one is generally rather easy. This is the 512. Now just tell me left or right. Yep, that one was pretty soft. Good. Right, yep. Let's see. Last one is quite high-pitched. This is 2048. Again, don't feel bad if you can't hear this one because it's very high-pitched. Just let me know what side it's on. Try that one again. Good. Good. Yeah, that one is tricky, rather. Not as badly behaved as the spore one. The tines are not quite straight. This one's a little bent, so this is what you get. It's a nice tone, but it only lasts for about a second. Close that up. And let's see what we got. We are going to move on to your nose and our cranial nerve that governs the sense of smell that supplies nerves to the nasal mucosa is called our olfactory nerve. So I'm going to just get a little bit of a smell here that I'm going to have you identify. Get a good amount. Now, if you could just tell me what this smells like right here. Yep, that would be isopropyl alcohol. Very strong smell. I'd be quite concerned if you couldn't smell that one. I'd like to take a look at your nose, and we're just going to take the speculum off the otoscope so that I can see inside of the nasal passages. If you could just tilt your head up a little. I'd love to just take a little peek here. Looking at the septum and the nasal passages. So, do you get nosebleeds often? Yes, this year has been particularly brutal and dry. I've been waking up with nosebleeds every day for a month. And do you snore at all? Okay. Any issue with breathing through the nose? Okay. Good to know. Do you experience frequent seasonal allergies? Does your nose run a lot? Okay. Alright, and does this ever feel very dry or inflamed? Okay, I'm just going to press around in here. Any of this painful or tender? Good. Okay, now we're going to do a little breathing test. I'm going to occlude one of the nasal passages and make you super nasally. And I'm just going to have you take a few breaths. We're just going to make sure that each passage is able to breathe independently. So I'm going to just occlude this one. And if you could inhale and exhale. Inhale. Exhale. Good. Other side. Inhale. Exhale. Exhale. Very good. So, nose looks to be good. Now, we will be moving on to the mouth and the throat. After we just double check the sinuses. So, your main sinus cavities, your those are going to be frontal, ethmoid, maxillary, right in here. So these spaces, these can get inflamed, get infections, and if I press or tap in these, they might be tender. So just let me know if they feel tender or painful at all. Okay. Just press here on the frontal. All good? Ethmoid. Maxillary. Okay, now I'm going to do some direct percussion, which just involves me tapping along these areas. So we'll just get my fingers all poised and ready, and we'll do a little tap, tap, tap. Okay. No pain or tenderness at all? Very good. I'm going to have you open your mouth. We're going to take a look at the oral mucosa, the tongue, and of course the throat. Look at the pharynx and see what's going on in there. Open the mouth and we're just going to look at the tissues and the teeth. The salivary glands. Just going to this lower lip. Lever it down a bit. Okay. Good. Let me know if I hit a sore spot. Can you just lift the tongue to the roof of the mouth? There we go. Okay, floor of the mouth looks good. Good coloring. No lesions here. Okay, can you stick out your tongue and just turn it to the side? And the other side. Okay, and out as far as you can. Good. Surface and the sides look good. You can put your tongue back in your mouth and I'll look at the side here. And we'll see if we can get to the hard and soft palates. Okay, there's the hard and then soft. Alright. Looks good. And can you just stick your tongue all the way out so that I can put my tongue depressor on your tongue and look at the throat. See if the throat wall has any goofiness, cobblestoning, if the tonsils, if present, if they are out, inflamed, swollen. If there's any little nodules. Okay. And would you mind saying ah for me? There we go. Okay, good. Have you noticed any difference in your sense of taste at all? Okay, so a nice little pharynx we've got there. Now to check the larynx. As you've spoken to me, I haven't noticed any hoarseness or difficulty in your speech, but I'm going to have you just repeat some simple phrases, sentences, just to make sure that that is all good. So if you could just say, the elephant walked through the market. Elephant walked through the market. Swam the 7 seas. The aardvark likes a variety of food. Don't know that that's actually true. Just a little sentence. The blue house sits on a red mountain. Okay, last one. We have the mouse lives in a tiny burrow. Alright, so overall, voice sounds good. Nothing was odd about your pattern of speech. Make sure that I have everything. So check for any cancers, ears, nose, income, cavity esophagus, and pharynx. larynx. Okay, that all looks good then. Oh, did you have any questions at all? Okay, just go ahead and sign that. So that will conclude our ear, nose, and throat and other things examination. I'd like to thank you so much for being so cooperative and patient. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you.